And I want to talk to you about one of the big developing stories, which is a concern about an outbreak. What am I talking about here? I'm talking about an outbreak for Hantavirus. You probably have maybe first heard of this virus over the last few weeks. We're talking about a cruise ship that where there was a few individuals that were stricken by this virus that produces what appears to be a respiratory infection. However, it has very high mortality rates, in some cases upwards of 50%. There's no known therapeutic for the hantavirus, so there's no approved treatment for it. It's more about supporting someone if they're struck, if they actually fall ill by this illness. And on this cruise ship, as you know, a handful of people died. You had several others that were evacuated more immediately because they were ill. And now this cruise ship is parked in the Canary Islands, and now these passengers are being offloaded. And the passengers that have been on this ship are being returned to their home countries. But the question has now surfaced, which is, well, how safe is that? And one of the reasons for that is the hantavirus, as you may well know already, is a virus that is spread typically from exposure to rodents that are infected with it, and not necessarily direct human to rodent contact. But if you're in an area where rodents are that are infected, you're breathing in the air, you're touching the surfaces, you could be exposed to this virus. The New York Times, in fact, described it. They said a very typical setting for this, if there is one, because you do see hantaviruses in cases in the United States, is if someone goes to like a hunting cabin that they haven't been in for several months, and they're in that cabin and they're being exposed to where these rodents were. Typically, hantavirus, which is overall very rare, but when we're talking about hantavirus, typically we're talking about rodent to human transmission. We're not necessarily talking about human to human transmission, but that's the catch, because on this cruise ship, the particular hantavirus strain is the kind that can be spread human to human. Also rare, but an important disclaimer here, which is why there's concerns about all of these different people representing more than 20 countries returning to their home countries with a question about, wait a minute, how much of a risk is it to the general public? So this morning, and I'm speaking to you now on Monday morning, the University of Nebraska Medical Center is going to be a focus of attention this week. And that is because of the 18 Americans that were returned to the United States. They went to Nebraska first. 2 are actually in Atlanta. We'll talk about that in a moment. But 16 are at the University of Nebraska Medical Center. And the reason for that is that it is the only national quarantine unit in the nation. Fascinating, right? I don't know about you. I thought maybe there'd be more quarantine units just kind of floating around, but apparently the University of Nebraska is particularly set up for this. So you have 15 of these individuals that are in quarantine. You have one that's in biocontainment. These are different things. And actually, we heard from the medical director of the biocontainment unit earlier today. Her name is Dr. Angela Hewlett. And here's how she's explaining what these people are experiencing.
2 facilities or quarantine unit is designed for well individuals who need to be monitored. It is not a patient care space. It is much more like a hotel than a patient care space. We don't have the typical things that you'd see in a hospital room. It's a much more comfortable environment, actually, with some things that to help keep people comfortable, like exercise equipment, and it's a larger space, TVs and things like that. The biocontainment unit is a patient care space, and that's our unit, which is also located on this campus, and that's where we provide hospital-based care to people who need it. And those patients could range from being, relatively well and stable to critically ill, requiring multiple procedures and multiple interventions. And so we do have one individual who, as you know, was taken to the biocontainment unit early this morning, and I'm happy to report that we assessed that individual. They are doing well, actually. They currently do not have any symptoms and have a good appetite, although they're very tired, understandably, but it's been a really long journey for these folks. And so, again, everything appears to be going very smoothly. I'm really proud of how our team responded and how we all kind of came together to execute this very complicated, transfer of multiple different individuals into these different units.
So that's what we know of what's happening at the University of Nebraska. The 15 individuals that are in that quarantine unit that, as she mentioned, sounds a little bit like a hotel unit. It doesn't sound like you're in a typical hospital room. You have that exercise equipment. You have ways to kind of keep yourself busy. As these individuals were described earlier by another official as in good shape, good spirits, and asymptomatic. The biocontainment unit apparently has this one individual that is there was a question about, whether, what sort of symptoms that they were showing, or there was a reason for more oversight. You have two other Americans that are at the University of Emory in Atlanta, and they apparently were kind of uh, pulled away from this larger group, and Emory University Atlanta has them now. And were some questions that were not as specifically answered about these individuals. And at the time of this recording, we didn't have a statement from the university, Emory University Atlanta. So there's just a little bit of questions about them, because we do know that there were individuals when they were transferred to the United States were showing signs of symptoms and also had a positive test. So this is what's happening now. Again, health officials continue to say the risk to the public is low. But as we all know, we lived through a period of time where we were told that the risk to the public was low when it came to SARS CoV-2. I have to think back on this time period. SARS-CoV-2, right? It's the COVID-19 pandemic. And I'm really stunned, to be honest with you, just from a media perspective. I was listening to the different news sources today. I was trying to get prepared for our broadcast. I like to skip across a lot of different networks to listen to different interviews, want to make sure I have just the best information for you. And this sort of shrugging off of, oh, this is not COVID. This is way different. The risk of the public is low. It feels like it doesn't match the trauma that the public has been put through over the last several years. First being told there's nothing to be concerned about with COVID-19, to then being forced to stay at home. And I use forced obviously loosely here. In some cases, forced, depending on your community, encouraged in other cases. But it wasn't just the risk to the citizen and their health, it was the risk to the economy, to the community, to what transpired of arguments and debates over policy. It was a really big deal. This is not distant history. This is near history. This is recent history. And I actually pulled up for you just because I thought it was important to see. This is from the CDC archive, and it was from a transcript back in February of 2020. You're seeing a statement coming from the CDC, which is to say, while the immediate risk to the general American public remains low, yada yada yada, that wasn't the case. So there's real reasons for questions about hantavirus. Number one, it is very rare. It is absolutely very rare, including this statistic that I pulled from the CDC, also reported from the New York Times. At the end of 2022, there were just over 860 cases of hantavirus reported in the United States since surveys began in 1993. So, I mean, it's very, 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 very rare. However, as I mentioned, the Hanta strain that can be found or has been seen in the southwestern part of the United States, and that it doesn't necessarily have to be transmitted human to human, has a mortality rate of 38 to 50%. So it's high. So yes, rare, but also, not something that you'd want to be exposed to necessarily, and not something that you can just shrug off as, well, there's a treatment for that. Well, there actually isn't a treatment for that. There's support for it, which is why these individuals are going to be probably staying in this unit for some time. The incubation period for this virus is 1 to 8 weeks. 1 to 8 weeks. And so it's possible that someone could come back completely asymptomatic after being exposed on a tight cruise ship where there's shared surfaces, even if they were being quarantined in their room, and experience symptoms at a later date. So it'll be very interesting to hear how this is handled moving forward for these individuals, especially as we wait to see, do more of them test positive for this particular virus, and what happens next. Here is a statement coming from the World Health Organization. This is how they are describing the hantavirus and the risk. I want you to hear from them so that we mark what's being said on the record in early May of 2026.
This is not coronavirus. This is a very different virus We know this virus, hantaviruses have been around for quite a while. There's a lot of detail that we know. I'm going to ask Anais to come in and say this, but I want to be unequivocal here. This is not SARS-CoV-2. This is not the start of a COVID pandemic. This is an outbreak that we see on a ship. There's a confined area. We have 5 confirmed cases so far. We completely understand why these questions are coming, and we are trying to provide all of the information that we can. That's why we're having a press conference here to give accurate information, and we're grateful for all of those who out there who are asking these types of questions. But this is not the same situation we were in 6 years ago. It doesn't spread the same way like coronaviruses do. It's very different. It's that close, intimate contact that we've seen. And most hantaviruses don't transmit between people at all.
So that's the description coming from the World Health Organization. Important to note all those key differences. We want to make sure that those key differences are very clear. At the same time, uh, in general, when I'm looking at this news, I'm thinking about, well, how can we have compassion for a public that just recently went through a global pandemic and may have a few more questions than if they hadn't? So right now, this is where things stand. We'll wait to hear about more information about specifically the Americans, but important thing to know as well is that you have all these passengers returning to their home countries. This is ongoing, and there's different ways that these different citizens from different places are being reintroduced into their communities. So just a story to watch and one we're going to keep an eye on, especially with that press conference early this morning with some brand new information as we started off the week. I wanted to make sure I shared that with you. So thank you for your support of quick, concise, nonpartisan, smarter news. We'll be here with all the developments on smarternews.com and across social media as well. So find us there, Instagram, X, YouTube, wherever you prefer. We love seeing you and we appreciate your support. Have a great week wherever you are, guys. I'll see you soon. Bye.